Hey, this is Erin from Educated Nurse, and I'm going to be talking about my second section of my lecture series on going from an ER nurse to breast cancer patient survivor and back again. And this second lecture is going to be on chemotherapy, so follow along. I do want to put a disclaimer out there that this video is for instructional purposes only. Okay, so I'm going to share a lot about chemotherapy and just kind of run through my process. And again, this is not the same for everybody, so please, again, follow the instructions of your physician. But before I had chemo begin, my doctor placed a port or portacath in my chest so I could receive medication easier and I didn't have to get poked a million times. Typically, if you have chemo that's right away, they'll put the port in. And for like me, I saw my doctor on a Wednesday, they put my port in on Thursday, and I started chemo the following Monday. It's placed in a couple of different places. Mine was placed under my skin, kind of under my chest on the opposite side, so on my right side, because my breast cancer was on my left. It's pretty minor surgery, in my opinion. Took about 20 minutes, and it was really nice. It was just a small little incision right underneath my collarbone, and again, they can just use a needle to poke that and draw blood so you don't have to get a million pokes through your IV. So I thought that was kind of nice, something that it was offered, and that's really going to depend on the kind of medication that you're going to get, how frequently, etc. And if you even want it. Some patients don't want a port. I potentially, chemotherapy will eventually wreck your veins a little bit, so it's something that I wanted, but everybody is a little bit different. Okay, so let's dive into chemo, and we'll just kind of start with like the day of chemo. In my experience, chemo days were really long. I was always told plan to spend 5 to 7 hours a day at chemo, and I can't speak to every facility or everyone's chemo regime, but the morning of chemo, I would get up about 8:30 and head in by 9 o'clock. I would have my port access, and they would draw labs. After that, I would meet with the oncologist and review how I was feeling, my weight, and a lot of chemo medications are weight-based. She talked about my diet, my pee and poop status, and then she would decide if I got chemo that day based upon my lab results. She'd also do a physical, and we'd talk about what was working in the last cycle and what wasn't. Medication adjustments were made if needed. And then about 9 to 10 o'clock, I would sit in the infusion chair for my pre-medications. And those differed a little bit based on the chemo that I was getting. Around 11 to 11:30, I would actually start my actual chemo infusion, and infusions would last anywhere from 1 to 3 hours. After my infusion, they'd let the remaining fluids run. So again, it was about a 6 to 7 hour day. And unfortunately, all of these different times and tasks were very dependent on the previous tasks. If labs were bad, no chemo. If labs were good, we were a go for chemo, but then the pharmacy had to mix it and send it down. On days 1 and 5, when I started a new medication, and again, that could be different for other people, I sat out in what I effectively used to call Gen Pop, or general population, a little jail humor for my deputy husband there, instead of a private room, so the nurses could monitor me more closely in case I had any side effects or emergent reactions. I remember my first day. I was anxious about them accessing my port as it was still fairly tender from surgery, so I lathered it up with this numbing cream called Emla cream. The access went fine, so that was good. I was just a little sore. I started with my pre-meds, which were Zofran and dexamethasone to help with nausea, and it's also a steroid to help with inflammation, which is the dexamethasone. Zofran is for nausea. They also had a little bag of fluids going, and then after the Zofran was done, I got another medication called Amend, which is a long-acting anti-nausea medication. Unfortunately, I had a reaction to it and it had to be stopped. My tongue swelled up and I got really tingly on the roof of my mouth, and my neck and ears really got red. So no more of that. And I just remember thinking to myself, like, there's no reason to die before the dang chemo even starts. So after that, I was switched to a different med called Aloxi. Once pre-meds were done, I got my chemo. And we started what was called the Red Devil, which is adriamycin or doxorubicin, and then Cytoxan. Mixed together, it literally looks like red Kool-Aid. It's very toxic, right? And there's typically a lifetime dose of this medication. It's dosed on weight. So every day when I would go in and I would get weighed, they would max out the dose for that day based upon my weight. The unfortunate thing, or maybe it's fortunate, I don't know, because it is so cardiotoxic, so it's bad for your heart, or has the potential to be bad for your heart. They probably, if I were to get cancer again, I would not be able to get that medication because they maxed out my lifetime dose of that med. So I'd have to do something else. But like I said, it looks just like red Kool-Aid. And I noticed when the nurse was giving me the infusion that she was pulling back on the syringe as she was giving it to make sure we were still in the vein. If not, chemo can leak into the tissue and actually cause quite a bit of damage. So I thought, okay, pulling back for blood was a good idea. And I remember one nurse telling me that the Red Devil med was stealth, and because it was red in color, it blended in with my circulating blood, and the other cancer cells never saw it coming. And I was like, okay, a little guided imagery for you, whatever helps paint a picture, I guess. After the Red Devil, they hung the Cytoxin for 1.5 hours, and I kind of waited. I usually ended up sleeping every day. We got a lot of education at the bedside. I learned all about the side effects and the pharmacy of medications I was going to start taking. I think at one point I was taking like 30 different pills. I mean, it was a little ridiculous, to be quite honest. But you got to do what you got to do. I learned about good hand washing, foods to eat, and which ones to avoid. I remember them telling me that I had to flush the toilet twice to make sure that my toxic urine and poop got out of the toilet for the next person. I washed my clothes separately. It was all really overwhelming and scary, honestly. Luckily, they give you handouts in case you forget. And my nurses always recommended that someone comes with you on education days just for a fresh set of ears. By the end of chemo, I was feeling like my stomach was growling and I felt really dizzy. My mom ended up taking me home because I could barely make the car ride. Where I was getting chemo, it was about a half an hour to my house and only about 10 minutes to her house. I remember getting nauseated, but I never threw up, and I wish I would have. I probably would have felt better. I remember being walked upstairs and laying in bed while my mom rubbed my back, which is a normal side effect, unfortunately. And I got a cool washcloth for my excruciating headache. My dad hit the grocery store for saltines and ginger ale, lemon drops, cough drops, animal crackers, you name it. Anything to get me to eat. All I could do for that first night was just lie in bed and try not to vomit. And I remember I took my 4 medications that I was supposed to take and I went to bed. 3 days after chemo, I would feel pretty dang tired and nauseous. I often went into the clinic for ER or the ER for fluids because I was dehydrated. I remember my first round of chemo, I lost 13 pounds in the first week and my oncologist told me things could not continue. And I remember thinking to myself, well, shoot, my high school jeans are going to fit again. But I knew that losing 13 pounds every round of chemo wasn't healthy. Around 5 to 8 days after chemo, the nausea subsided, but the fatigue remained. I ended up taking medication for chronic constipation and eventually developed an anal fissure that would hurt and bleed every time I pooped. And then, just about the time I was going to go back into my next cycle, about day 12 to 13, I'd feel normal and I'd feel myself just to have everything happen to start all over again. This cycle kind of continued for 2 to 3 months, and then I was on to my next chemo treatment. In month 3, I started Taxol. I decided to do stacked doses, which is 3 doses in one. This way, I only had to do 4 cycles, one every other week. The other option was 12 cycles once a week. No thanks. I didn't want to be poked extra 8 times, even if the side effects were supposed to be less. Nothing changed on infusion days except the pre-meds and the infusion time was longer. According to my oncology nurses, I remember this, Taxol had a really high rate of allergic reactions, so they gave me Benadryl, Pepcid, Aloxi again, and Decadron, which is another steroid. All of these medications helped fend off allergic reaction and help with nausea. It was also good, per the nurse, that an emergency epinephrine kit, along with an intubation kit, was standing by in case they needed to put a tube down my throat and secure my airway. Okay, I guess that was a good tip. Within a couple minutes of me getting my IV Benadryl, I was loopy. I guess I entertained my husband for like 30 minutes. He has blackmail videos to prove it. It made me very giddy irritable, gave me tremors. Eventually, I had to get up and walk around because sitting in the chair one more minute wasn't going to happen. But prior to this, I had only had oral Benadryl. But patients who get IV Benadryl, apparently this is kind of a normal reaction, considering how fast they gave it to. After I walked around the infusion center, I usually fell asleep for 2 to 3 hours. And I remember my first infusion, I woke up after that first time I had fallen asleep, and I was like, hey, nurse, did I have an allergic reaction? And apparently not if I had slept through it and they didn't have to intubate me. But as a nurse now in my own practice, I've learned and I've realized that these kind of reactions can actually happen when you give Benadryl fairly quickly IV, and so it's something that I've learned in my own practice that I don't do. With Taxol, unlike all the side effects that I had with adriamycin and Cytoxan, which I'll get into in another lecture, but with Taxol, I had no nausea, no vomiting, and I wasn't tired. I could eat again. It tasted metallic, but I could eat and drink whatever I wanted. But, I mean, holy cow, did I have bone pain, Batman. I kind of had a cycle with Taxol. Day 1, I felt great. Day 2, I had this burning and redness in my hands. In my first infusion, I thought I was actually having an allergic reaction, but I learned that was kind of a normal response. On day 3, I would wake up with this extreme muscle and bone pain. The muscle pain felt like I had just done the hardest lower body workout of my life. And the bone pain felt like sharp stabbing twinges in my knees and shins. I also developed neuropathy or numbness in my fingers, toes, heels, and face. With my hands, I felt like I had touched a hot burner and scalded off my fingertips. It was constantly throbbing. With my feet, I felt like I had run a marathon over hot coals and my toes were going to shoot off the end of my feet. The numbness was excruciating at times. Like when I was trying to go to bed, just touching my heels to the bed was so painful and I often kept me up at night. Wrapping my feet in a heating pad helped a little bit. I found pain medications wouldn't really touch that type of pain. I remember sitting under 2 heating pads and stretching out in the shower, and eventually my doctor gave me a medication called gabapentin for nerve pain. But according to my doc, I remember him saying that neuropathy can last years after treatment is completed. And typically the bone pain and muscle pain lasted for about 4 days, and then I felt better again. And to be quite honest, Taxol for me was a lot more manageable than adriamycin Cytoxan. Unfortunately, I still have neuropathy, 6-8 years later here, but, it's just something you gotta kind of deal with, I guess. It was very often that I would go in and would get fluids, or nausea meds, just, with the chemotherapy and not being able to tolerate things. The day after each chemotherapy infusion, I would go back into the hospital about the 24-hour mark, and I'd get a shot called Neulasta. And Neulasta was given to help stimulate the growth and production of healthy white blood cells during what's called the nadir period. And the nadir period is a low point in between chemo cycles when you have really low blood counts. And it usually starts about 7 days after chemo and peaks 10 to 14 days until you recover, which is about 21 to 28 days later. This is kind of why some people get their chemo on a 3-week basis, because it allows the body's own bone marrow to make their own white blood cells. And if you're on more of an accelerated schedule like I was getting chemo every 2 weeks, and then they'd give me this Neulasta shot to boost my white blood cells. The life cycle of a white blood cell is 21 days, so they're giving you chemo to kind of interrupt that cell cycle and that division of the cell so they can interrupt it and kill it. The shot of Neulasta can be really painful. I always got mine in the back of the arm, and I just remember it stinging a lot. They always took it out of the refrigerator too, which I think made it worse. But anyways, for me and my insurance, it was really expensive. It was $8,000 per shot. Thankfully, I had insurance, and we just had to pay the copay. But when I saw the first insurance bill, I just about dropped to the floor when I saw it. But really, in the grand scheme of things, getting an infection and requiring an ER visit or hospitalization would cost a lot more than $8,000, and that's kind of how the nurse and me justified it to myself. Um, May 18th of 2016, I had my last day of chemo. There were times where I thought the day would never come, days where I thought I was going to question the process, and really at age 33, I never imagined that I'd be diagnosed with stage 2 breast cancer. It was physically, mentally, and emotionally challenging, but it was done. It was by far the hardest thing I had ever done, and I don't ever wish chemotherapy on anyone. All right, I want to briefly touch on side effects. And again, this is what I experienced. This is not what everybody is going to experience. And some people might have other side effects, but these are pretty common. But just keep in mind, chemotherapy is toxic, literally. It is super strong shit. It's trying to kill cancer. And with that is going to come a bunch of side effects, just like any other medication you take. Each medication has different side effects, and your oncologist should discuss that with you. Although, I have listed a bunch of the side effects and the things that I experienced and how I managed. But again, not everyone will have the same meds because your chemo will be very specific to you and the kinds of tumors that you have. All right. So, first things first, nausea, pretty common. I know it sounds kind of counterintuitive, but eating little bits and drinking helps. Broth, soup, lemon drops, saltine crackers, fruit, Gatorade. Stay away from red. I thought I was peeing and pooping blood at one point because of the red dye in the Gatorade, so I learned that pretty quick. Carrot cake, whatever it takes. And to be honest, I say carrot cake because for a while, all I was doing was eating carrot cake and drinking chocolate shakes from McDonald's. But hey, getting in something is better than nothing. A little sugar and salt when you're dehydrated can help with headaches too. It's also important to stick with your scheduled nausea medications. Often the doc will put you on a combo of meds to help you stay on top of that, so don't get behind. And if the meds aren't working, let your doctor know. I had to change mine 3 different times before I found a winning combination. I was told by a friend that essential oils like ginger and mandarin were supposed to help with nausea, but honestly, the smells were too strong. I found that when I lost my sense of taste, my smell heightened, and I still kind of pride myself on being a little drug dog these days. But the smells were too strong for me, and they made me more nauseous, so I really couldn't do that one. Diarrhea or constipation, it kind of depends. In the beginning, I had diarrhea, and then as the chemo started working, it actually kills all of your rapidly dividing cells, and some of your rapidly dividing cells are found in your GI tract. That's why you lose your hair also. Those are rapidly dividing cells. So for me, I ended up having diarrhea in the beginning and then constipation. The anti-nausea medications that you take too, like Zofran and Compazine, can also make you constipated, so stay ahead of it by increasing your fiber, increasing fluids, or taking a stool softener. I ended up having to take a stool softener every day, and I still take them, and I'm, like I said, 8 years out at this point, so it never really gets any better. It might, but you just kind of have to really watch what you're eating, making sure that you're staying hydrated, and then get on a bowel regime. Vomiting, I kind of already hit on. Hair loss, this one can be hard. And again, it really depends on what meds you're taking. But for me, I was told my hair was going to fall out, and all of your hair. Head hair, leg hair, armpit hair, eyelashes, eyebrows, pubic hair, all of it. I guess you could say not shaving for like 4 to 6 months is one of the perks of chemo. And I remember my oncology nurse telling me sometimes 7 to 14 days after your first round, it'll start to fall out. So have a plan. And I guess she was saying was have a mental plan and how to prepare for that. After my diagnosis, before I had kind of like mid-chest length hair. After diagnosis, I cut it to a shoulder length for a week, and then I got a really short pixie cut with funky colors. I mean, I'd never done that before, so why not, right? It's going to fall out anyways. Plus, I also had little kids, and I didn't want them to freak out, so I did this in stages. And so I cut my hair short to this pixie cut, and then the day after my first chemo, I had my husband buzz my head. Again, I didn't want them to be freaked out, and I didn't want to be freaked out. I wanted some control over something, to be very honest with you. The day of my second infusion, which was day 14, my head started tingling. And I could kind of just, I don't know, I could just tell or sense that something was different and wrong. So the night of my second chemo infusion, I remember getting up to go to the bathroom and I noticed my hair had started falling out onto my pillowcase. And then I noticed handfuls, in the shower. And I remember one morning I started crying because it was really falling out. And I called my husband up to the bathroom and he helped me wash my hair that day. I closed my eyes and I cried and he rubbed my head to get rid of the hair that was falling out. And once it was all said and done, we ended up just shaving my head bald at that point. It was interesting. All the hair off my body came and fell off except my eyebrows. I never lost my eyebrows, so that was kind of a good thing, I guess. But my hair started growing back about 6 weeks after my last infusion, and I got my first eyebrow wax again 11 weeks after my last infusion. I never was one to wear wigs or anything. I ended up just wearing baseball caps, and I tried a hot pink wig one time, but it wasn't a big deal for me. I just kind of rocked my bald head, but everybody's different. There's so many different things out there for wigs and head coverings and everything, so make sure to look into that. I finished chemo in May, and by August I was no longer wearing hats. I remember I had this cute little buzzed pixie look, and about September, about 4 months later, my hair came back the same color, but it was really wavy. I had little baby curls and waves everywhere. I know a friend of mine had breast cancer, and she was younger than I was, in her 20s, and her hair came back and grew back, and it was full on this silvery gray, and it was beautiful. So the metallic taste, I kind of already hit on that a little bit. A lot of times they tell you to eat things that are, got like salty or sweet or sour. And I remember I would do lemon drops to kind of help with that. And I remember a friend of mine would make this chili that was just outstanding. And I would eat the chili and it had some flavor. They also recommend that you get rid of your metal spoons and forks and stuff while this is going on and just eat with plastic, so then it's a little bit more appetizing to eat. In terms of fatigue, this might be the only time that you can pull a Rip Van Winkle and sleep for 100 hours. So just sleep. There's a reason you're tired. Your body's really trying hard to fight and heal, and chemo will knock you out. So if you have a moment to sleep or nap, do it. You'll find that there are nights when you don't get a lot of sleep, so if you can nap during the day, do it. And if you're having trouble sleeping, ask for a sleeping pill. All right, muscle and bone pain, I'm going to get to that in a little bit when we start talking a little bit about Taxol, but dizziness, some of this can be from meds. It can also be from dehydration. There were times where I would just move my head and I'd get dizzy doing nothing. Other times it would be from sitting or standing too fast. In the first few days following chemo, I never really felt safe, to be honest, driving. And that got better and went away. But move slowly, stay hydrated. Chemo brain, it's also known as brain fog. So short-term memory loss is also common. Stuttering and dyslexic moments are normal. I still get easily distracted and have a hard time focusing. And I remember I got really frustrated with this because I knew what I wanted to say, but the words either didn't come out or they didn't come out right. It was like my brain and mouth weren't connected. And again, 8 years later, I'm a nursing instructor, and there are definitely times where I know what I want to say, but I can't always figure out what words I want to say. As time passed and chemo was farther and farther away, my brain got more clear, and I was able to think more logically and critically about stuff, but again, my words still get mixed up to this day. Acid reflux, that was pretty bad. I got super bloated and gassy even after eating the smallest meal. I tried Gas-X and I ate those like candy. Eventually they stopped working and burning, and reflux got worse. I even started regurgitating some of my food back up. There was a point too where I remember I looked like 8 months pregnant and I didn't even feel like my stomach was emptying. So my doctor put me on a new med called omeprazole, and my acid reflux went away. So, and a few weeks after I was done with chemo, I was able to get off of the omeprazole. Loss of menstruation, so chemo stops and inhibits ovarian function. So not the most terrible side effect because I didn't have a period for like 18 months. It was kind of fantastic, but it really depends on your age, the type of cancer, and chemo and the meds that you're taking. The other thing that's super important, and I was done having children at this point. I had had 2 kids when I was diagnosed. But if you're thinking about having kids, this is absolutely when you need to have a conversation with your oncologist or OBGYN before chemo starts about if you need to freeze eggs or, if you need to think about potentially later fertility. All right, so just hitting on Taxol a little bit with the muscle and bone pain. I talked a little bit about that with my infusion, but the neuropathy and numbness, I still have neuropathy and numbness, and so my doc put me on gabapentin. But on nights that I had a hard time sleeping, I'd wrap my toes in a heating pad, and that lasted for about 8 months after chemo. And to be quite honest, I got to the point where I felt like I was walking around on stumps. I couldn't even feel my toes. And the first time I tumbled down our stairs and I broke 2 toes and I skinned my knee and had a bruised ego and multiple slips in the shower, I ended up buying a non-slip pad for the shower and socks with grippers on the bottom. And I'm like, I know, you're like 80 years old, but from the bottom of my nurse's heart, just think about safety here. For me, honestly, the best remedy was getting a prescription for gabapentin. It did make me really sleepy and tired, but it worked, and I still take it if I need it. Last, I kind of had these dry, watery eyes, and then I did get kind of a runny nose, and again, chemo kills all the rapidly dividing cells, so the little nose hairs in your nose will actually go away, and your nose will just drip. And I am 8 years out at this point, and my nose still drips. People probably think that I have a cold all the time, but my nose just drips all the time. For the dry, watery eyes, I ended up getting like a gel, a Refresh liquid gel eye drop, which really helped hydrate them because it felt like I had sand in my eyes all the time. So again, these are just the side effects that I had. It's not going to be the same for everybody. I've included some things that worked for me, but work with your doctor or nurse and really figure out a plan to help you navigate these side effects so you're not miserable. In all honesty, chemo sucked. Like I said, it was probably the worst thing I have ever experienced and had to go through in my life. It was harder than surgery. It was harder than radiation. It challenged everything. It challenged me physically and mentally and emotionally. And it really made me question if I was always doing the right thing. And really, chemo is not rainbows and unicorns. It sucks. I remember I went in every other week and got poked with that 1-inch needle into my port. The needle allowed the nurses to draw my blood work and connect my IV tubing. I guess the positive was that they don't fish around for a vein multiple times, but I still didn't like getting poked. Now, the ER nurse in me, I love to poke others. I didn't like to get poked. I got 3 to 4 medications to help prevent or lessen a side effect or an allergic reaction before my 3-hour infusion. Those medications had side effects. Everything had a side effect, and you took another medication to deal with another side effect. After the infusion, I was so tired. I was tired for days to a week. I usually felt like myself again around 7 to 8 days, but I had no energy. Some of this was due to low hemoglobin and low oxygen, but the meds make you tired. And that's okay. I took naps almost every day. I used to box and work out 3 to 4 times a week, and during treatment, I couldn't even walk up a flight of stairs without getting short of breath. This whole process is super humbling. Nothing tasted right. Losing taste, or things just had a metallic taste, and that's normal. Some people even develop mouth sores. Many times things don't sound good, so I ate the same meals over and over, or I didn't eat at all. I didn't really sleep. Pain meds kept me awake at night, along with the steroids, and then you have all these thoughts going through your head about how much cancer sucks. I tried different sleeping pills, medication, a rain machine. Some worked, some didn't. Eventually I fell asleep after being up for hours, but I never really felt rested. My mind constantly wandered. I thought about treatment. I thought about all the pain that I was in. I thought about my kids, my husband, going back to work. I thought about what my future held. Would I live a long life? Would I not? Sometimes due to the meds, I know what I wanted to say, but I couldn't say it. I felt foggy and I didn't have clear thoughts. My mind rarely shut off. And this fogginess has lasted for months to years, well after my chemo ended. And just when you feel good, about a week after the infusion, like I said, you have to be careful about venturing out into the world because that's when you're the biggest risk for an infection. I was never more aware or afraid of germs in my life. And being an ER nurse, I was like, yeah, whatever. I see all these germs all the time. No big deal. I used the little wipes at the grocery store to wipe the cart. I avoided crowds. I avoided sick people the best I could, and I had hand sanitizer everywhere. I didn't venture out of the chemo bubble often, not even for a holiday or a family gathering, because getting an infection with no white blood cells to fight is a big problem. Getting the slightest fever would have sent me into the ER and likely incur a 2 to 5 day hospital stay. It's scary and it's hard to live life like that. And really, I wasn't trying to complain or be negative. People asked all the time how it was going, and this is my honest answer. Even when you have a good day, cancer has a tendency to remind you of who's in control, and I tried to find strength in people around me and enjoy the little moments every day. But some days were good and some were bad. It depended on the day. And as you go through treatment, it's important to be mindful of your body and the changes it goes through. As I previously stated, the nurses should go to basic education regarding side effects and what to expect. And don't be afraid to call the nurse line with questions or concerns. You don't have to be alone and with, your mind wandering or not feeling well. It's better to be safe than sorry and ask questions or make some changes to your treatment plan if things aren't working for you. That's okay. Advocate for yourself. So we kind of talked about why chemo sucks, but I will give you 10 reasons why it's not so bad. In the beginning, when I had started chemo, my house was never so clean. My family was wonderful, and they all came over to steam the carpets and Lysol the furniture. And having cancer, I often thought about the harmful effects of chemicals in the home. But at this point, honestly, I wanted to kill everything. The last thing I wanted was an infection, so we cleaned our house from top to bottom, and it was so nice. And really, those donated meals from the meal train were never so wonderful because I used to cook all the time, and it was really nice when someone set up that meal train and had them delivered, so that was one less thing I had to worry about. Going through chemo, I got to save money on shampoo and conditioner because my hair fell out and I never had to worry about a bad hair day, and you get to wear funky hats and scarves and all that. I got to eat anything I wanted, which at one point, like I said, was ice cream, ramen noodles, carrot cake, and really no one cares. It's just important that you get some nutrition in. In the beginning, I thought to myself, well, it was an easy way to lose 15 to 20 pounds, but it came back on, so you got to be mindful of that. Every afternoon, and this is the nurse inside of me, Grey's Anatomy was on reruns every afternoon. I think I watched Grey's Anatomy twice. So were all the classic movies like Caddyshack, A Few Good Men, Top Gun, Pretty Woman, etc. And don't forget all those sappy yet cute and predictable movies on the Hallmark Channel. You don't have to shave for months. You can pull a Rip Van Winkle at any point and sleep and no one will care. If you're forgetful, you can blame your chemo brain. I often felt like my brain and mouth weren't connected, but blaming chemo was always a safe bet. Call me Daisy. My husband loved driving me around anywhere and everywhere, and to be honest, we hadn't had that much time together in years. So it was kind of nice just to hang out with just my husband. And lastly, during chemo, you will realize how many good people really care about you and that would do anything for you. And I know that not everybody is blessed with a really good support system, but for me, this is one thing that I really realized is that I had a wonderful support system, and I was really blessed for that. So here's a tip for surviving chemo. Like I said, find a routine that works for you. If something is not working or you're not feeling well, speak up, advocate for yourself, get a second opinion, slow down your treatment. It's just a chapter in your life. It's not your whole life. And sometimes your sanity and physical health is worth something. So if it's not working, speak up and make a change. You are in control of your body and your treatment. If you want to learn more, check out my book. I wrote this while I